When we think of a system failure, we usually picture a crash. Something shatters all at once. But many systems don't break that way. They lose pressure, drip by drip, over years. Right now, millions of people are walking around with a medical condition they have completely misidentified as their own innate personality. They describe themselves as naturally gray. They assume they are simply a chronic pessimist or a perpetually tired person. These aren't character traits. They are the clinical symptoms of a specific, treatable condition called persistent depressive disorder, historically known as dysthymia. The defining metric of PDD is an uninterrupted, low-grade depression that runs in the background for a minimum of 2 years. What millions of people accept as their core identity is actually a long-running, unacknowledged systemic error in the brain. If you live with PDD, you likely cannot pinpoint a distinct before and after state in your memory. The onset is entirely blurred. The primary clinical footprint consists of 3 persistent deficits: a chronically low mood, a severe lack of energy, and low self-esteem. This radar chart maps the secondary behavioral and cognitive symptoms. You see markers for disrupted sleep, changes in appetite, pervasive hopelessness, and difficulty making decisions expanding steadily outward. Notice that they remain completely trapped beneath the rigid outer boundary of an acute crisis. Because these symptoms never spike into an active, life-threatening emergency, they evade detection. The patient and their loved ones simply adapt to the degraded baseline. The duration of the illness acts as its own camouflage. How does the passage of time actively mask the disease? This line graph tracks a mood baseline over 2 full years. Instead of a sharp drop, you see an imperceptibly slow, gradual downward slope. Because the symptoms drip slowly, the brain fails to register the decline. Over time, psychological habituation takes over. The horizontal threshold line for normal slowly descends to meet the depressed baseline, recalibrating the brain to accept the illness as standard operating procedure. After 2 years of this recalibrated reality, the psychological consequence sets in. The patient completely internalizes the symptoms. They arrive at a dangerous conclusion. This is just how I am. The true danger of PDD isn't the daily severity of its symptoms. The danger is its ability to hijack a person's sense of self through prolonged, habituated exposure. But the healthy self is still intact underneath. That gray personality is highly reversible. In fact, PDD is incredibly responsive to targeted clinical intervention. Clinicians use distinct psychological frameworks to actively dismantle the brain's habituation, specifically cognitive behavioral therapy, or CBT, and interpersonal therapy. To physically raise the mood baseline, neurochemical interventions like SSRIs and SNRIs are introduced. This comparative bar chart shows the success rates of these interventions. The data is definitive. The combination treatment column stands significantly higher. Combining therapeutic frameworks with medication vastly outperforms using either method in isolation. Effectively treating PDD requires this specific multi-layered approach to break years of hardwired habituation and successfully reset the system. If you suspect you've been living with a slow leak, you need an evidence-based team to implement that specific combination treatment plan. Coping and Healing Counseling, or CHC, is a telehealth therapy practice serving all 159 Georgia counties. They maintain a culturally competent, diverse team of over 15 licensed therapists, including clinical social workers and marriage and family therapists, capable of executing these precise therapies. This infographic displays CHC's accepted insurance networks and exact costs. Medicaid patients have a $0 copay, while major commercial plans like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana range from just $10 to $40 a session. Because CHC is 100% telehealth and is entirely HIPAA compliant, all physical barriers to entry are eliminated. Don't accept the gray as your personality. Contact 404-832-0102 or visit chctherapy.com to start your reset today.